There are different perspectives from which one can evaluate leadership literature. One angle is gender and leadership effectiveness. And that research stream asks the following question: would we have enough evidence to start concluding that women might be more effective leaders than men in a crisis? So let me just give you a few examples of this research that is supporting this claim that I just made. On the one hand, we have quite a bit of evidence from the legal profession that female attorneys are being disproportionately selected to handle and to litigate hard-to-win cases. We have the very similar evidence for political elections where, again, women are disproportionately selected to run to try to get those seats that are very hard to win. Then we have more of a business side evidence that during the 2008 economic crisis, that companies with women CEOs were simply getting through the crisis with better outcomes than companies with men CEOs. And lastly, there is quite a bit of growing evidence that the more women are on the board of directors, the better the company does. So that was the background for the topic we set out to examine, which is, could it be that female governors are more effective than male governors in the United States during COVID, during the about 4 weeks of the really heart of the pandemic, in terms of death counts? So my co-author, Kayla, she will tell you much more about where we got this data, why this data is better than the most of the data that it's out there. And I will just emphasize the high points, which is the data was out there in the public. It was archival. Everybody has an access to it. And one angle that I like about it is that, frankly, our predictors and criterion have very little measurement error. On this angle of things, on this side of things, we have gender, where we ought to be able to get that right. And here we have officially reported death count. So there was very little in terms of measurement error there. So I particularly like that, and I will have Kayla explain to you exactly the specifics of the data and all the analysis, and there were fairly sophisticated analyses that we performed.
Thanks, Alex. So before we go into the data from our study, I think it's important to talk about some of the reasons why we saw these intriguing effects that Alex just told us about. So first, women leaders tend to exhibit what we call more curvier linear thinking. So in a crisis, things are unfolding really fast. People don't always have direct experience to call upon. So women, more so than men, tend to use creativity, intuition, and flexibility. And these are findings we know from both psychology and neuroscience research that we see more from women leaders than men leaders. Women also have a tendency to foster collaboration. There's been a lot of studies on gender and leadership style, and what they found is that women have this democratic leadership style, where they invite others to the table and they seek diverse views. Research finds that men tend to have a more autocratic leadership style, which can be okay in different situations, but in a crisis, the more input that we bring to the table, the better the decisions that we can make. Another thing that women tend to do more than men that helps them be leaders in a crisis is show empathy. So followers are looking to their leader in a crisis for direction. So the more that the leader can both connect with the feelings of their follower, as well as acknowledge the concerns of their personal welfare, the more receptive the followers will be to actually listening to the leader's guidance and following through on the decisions that the leader makes. Confidence is another difference that we tend to see in terms of crisis situations between men and women. Whereas men might focus more on confidence in terms of showing power, women tend to show more confidence and sensitivity in how they connect. One reason for this is because when people fail, and in a crisis, let's be honest, leaders are going to fail. They're going to make wrong decisions. Mistakes are going to happen. Men tend to take these mistakes and failure more personally. They view it as a personal deficiency. They're less likely to overcome it, whereas women make attributions that are less tied to themselves, which make them more confident in a crisis when these mistakes might happen. So that's the theoretical background for why we might see women tending to be more effective leaders in a crisis. Let's get into the data that we looked at in this study. So as Alex mentioned, we were focused on United States governors. We used publicly available data on COVID-19. So the New York Times had a data set of death counts, and that's what we used. And then the National Governors Association had information available on the different actions that states were taking. This allowed us to include a number of what we call control variables to isolate that effect of gender. So what did we do? Well, we included state population. We included, in addition to governors' gender, we had their age, we had their political affiliation, we had their experience. We also included different actions that the states had taken, such as bans on travel, mandated face masks, whether they were allowing hospitals to participate in ventilator sharing, and importantly, whether they had issued an early stay-at-home order before it became the norm. What we found was two-pronged. First, we found a significant effect of gender, such that states with women governors had significantly fewer deaths than states with male governors. We also found a significant interaction between governor gender and early stay-at-home order. What does this mean? For states that issued the stay-at-home order early, people were more likely to respond positively when it was issued by a woman compared to when it was issued by a man, as evidenced by much lower death counts in those states. So you could say, okay, that's interesting, those relationships, but why did we find that effect? And so this gets back to some of the theory we were just talking about. We were able to look at two of the reasons that women tend to be more effective. We looked at empathy and we looked at confidence. And how we did this was we collected the transcripts of all of the governor briefings from April 1st to May 5th, which was the cutoff for our death count variable. We analyzed the words spoken by each of the governors in this period. So this included over 250 governor briefing transcripts and over 1.2 million words. We used what's called the linguistic inquiry and word count software, which is a text analysis. And what we did was test for how often are governors speaking to the feelings of their followers and their personal welfare concerns, such as their jobs and their money, finances. It's on everybody's mind during the pandemic. And what we found was that women governors spoke significantly more about their followers' feelings and their personal concerns, which shows that they exhibited more empathy. We also looked at confidence, and we found that women tended to exhibit more confidence in terms of there is a brighter future ahead, compared to male governors who didn't show the same degree of confidence. Taken together, what this data tells us is that by showing empathy and confidence, women governors were able to get greater volitional compliance from their residents, who then wore their face masks, who stayed at home, and sort of took direction a little better because they felt more connected. So that's what the data from this study tells us. I'll turn it back over to Alex, who will give us some more broader takeaways from what we can do with this information.
So you've heard all the details about data, and you can say, okay, we get that, but what are some implications of this? What can we do with this going forward? And that's a really important part, because it might be too easy to conclude, oh, these are just inborn differences, right? Women are different from men. And that's not necessarily where we're coming from, because most of our theory is based on social roles, that there is a mediator, if you wish, the variable in between the gender and the outcomes. And that is how we're raised, what we learned, how we got socialized in a society. So therefore, the implication is there is nothing in here, what we found, that men cannot do. And obviously, in some instances, women are better, men are better. In this case, we just studied this during the crisis. But there's nothing really to stop us to develop a training program, if you wish, in which several points would be emphasized. One is build a culture of inclusion, but make sure that you have different voices and make sure that those different voices are actually heard. So before you dismiss empathy, maybe think twice about that maybe that brings a different set of information than something else does. So having more, at least according to our study, what we did here, having empathetic and confident leaders seems to be a pretty good set of characteristics to have, again, at least given what we found. How do we do that? Well, I'm a guy, I don't see a slightest problem if somebody organized the training session at work and says, listen, we have just learned that women have a little more empathy and confidence than men do. Here's what those constructs are. You don't seem to be exhibiting that all that much. Here's a few modeling session, perhaps, or some vicarious learning session in which we can discuss what these are, practice them a little bit, and maybe you'll just simply have a little more knowledge tomorrow than you had yesterday. I absolutely see no problem with this if it's done, as I said, properly. And in terms of style and substance, if that's approached in a sort of scientific way, here's what we have, this is the latest evidence, here's what we found, here's what could be done. I personally see no problem with that because many people can simply benefit from it.